Let's get started on the skeletal system. You probably already know that bone tissue is composed of inorganic salts, water, and organic material, bone cells, blood vessels, nerves, and collagen. Bone cells have to continuously receive food and oxygen. They continue to grow for the first 18 to 20 years of your life, and bone cells do die and are replaced by new ones. Bones also may have cartilage. There's something called ligaments that attach bone to bone, and there are tendons that attach bone to muscle. So make sure you always know the difference between those. The structure and function of the skeletal system. Again, it provides a shape, support, is also good protection to our internal organs, such as the bones around your eyes. They're thick, they're heavy, so if you get hit in the eye, it's protecting. You've got your breastplate, your breastbone or sternum, your rib cage protects your lungs, protects your heart. Our internal gut organs are more vulnerable, more exposed, but also bones store fat and minerals. They produce blood cells and platelets and assist in movement. There's different types of bones. We're going to group them into the two major groups, the axial skeleton, which is the 80 bones of the head and the trunk, and then the appendicular skeleton, which is 126 bones of the pelvis, arms, shoulders. Here's some pictures of the common skeletal bones. These are the ones I want you to know, even though there's 106 bones. This is about 30 or so that I would like you to be able to identify in a diagram. So there's different shapes of bones. The long bones, your femur, which is your thigh bone, your humerus, which is your upper arm, the radius and ulna, which are the lower bones of your arms, and the tibia and fibula, the lower bones of your legs. Those are all called long bones. Then there's the little short bones, the foot bones, the hand bones, the wrist bones. There's flat bones, the cranium that protects your brain, the costal bones, which are like your rib cage, your scapula, which are your shoulder blades, and your sternum, which is your chest bone. And then there's irregular shaped bones like the vertebrae, which are kind of shaped like, like a flower cut in half. Your jaw bone, your ilium, your ossicle, your kneecap. Those are irregular shaped bones. Believe it or not, your teeth are part of the skeletal system. Adults have 32 teeth, and each tooth has a different part. There's a little diagram here, but you see there's the crown, which is the white section above the gum, and part of that, of course, is the enamel, which is the hardest substance in the body, and it covers your crown. The root, of course, goes below the gum. The dentin is what's located between the enamel and the pulp, and there's a good picture of that here. And the pulp is the soft living part of the tissue that contains nerves and blood vessels. Teeth are really living parts of our body as well. All right, let's get back to the chest area, or the thorax. You've got your ribs. You've got 7 pairs of true ribs and 5 pairs of false ribs and 2 pairs of floating ribs. And that makes up your rib cage. And then you have your sternum, which is your breastplate, and your vertebral bone, which protects the lungs and the heart. Well, all the thorax bones do, but your vertebral bone is your spine. Speaking again about the vertebral column, there's 5 parts to it. The cervical area, there's 7 bones in your neck or cervical area. In your chest, which is the thoracic area of your body, there are 12 thoracic vertebrae. In the base of your spine, or the lumbar region, which is your lower back, there's 5 vertebrae, and then hanging below at the end are the sacrum and the coccyx. There's a curvature naturally to our spine, and that helps give us strength and flexibility. If it was straight up and down, it would be brittle and not be able to take impact as much. And there's cartilage between each of the bones in the spine, and they're like little cushions, but they also allow you to move more freely. Here's another picture of the cervical vertebrae, which again is your neck, the thoracic vertebrae, which is your chest area, and the lumbar vertebrae that is behind your gut organs, and then the sacrum and the coccyx. So it gives you that visual as well. I don't know why these won't advance, but I'm going to keep clicking on this. So the long bones of your extremities. Remember I said the long bones are your arm bones and your leg bones. That's where they contain marrow. Blood cells are made there. They grow and lengthen from layers of cartilage, and those epiphyseal plates in your body are something that we can see on x-ray to see if you've stopped growing or if they haven't fused yet. It indicates that you could still be taller. So there might be hope for some of you that feel like you're too short. And then the shaft of the long bone, or the diaphysis, contains fatty tissue and yellow bone marrow. And then fatty tissue is important because it does store energy. And our bodies use fat for energy. And a very efficient body uses fat regularly for energy. An inefficient body tends to use more carbohydrates. Long bones, again, of the extremity. The end of the long bone contain red marrow that produces red blood cells. So that's where red blood cells come from. Red marrow destroys old red blood cells. It forms white blood cells and produces platelets. So the bone marrow, there's a lot going on in there, and it's where your blood is produced, the platelets that make up your blood. There's something called a periosteum, which is something that covers the bone. And the medullary cavity contains osteoclasts, which enlarge the diameter of the cavity by removing bone cells. So there's a production and destruction of bone cells going on in the marrow. Love to talk about joints. Well, there's something called articulation, and that's what happens when a joint comes together, like when the ball and socket of your hip come together and it allows movement. That's called articulation. And hopefully that movement is smooth. So any place there's two or more bones that come together, that's a joint. There's different ways, so I'm going to talk about some assessment techniques, and then I'm going to talk about diseases of the skeletal system. There's x-ray. You guys will get to see x-ray quite a bit, the best anatomy lesson from the inside out. Bone marrow aspiration. They actually do these at the bedside in the hospital, and you might get to see a bone marrow aspiration. They're looking for an overabundance of cells or a depletion in cells, and they actually take a large bore needle and grind it right through the chest or through the hip bone and withdraw, that's what aspiration is, a section of living matter that looks like blood and calcium combined, and then they test it to see if there's too many red blood cells, too many white blood cells, or not enough of either. And it's something that some students, even though it's not extremely painful for the patient, it's painful to watch because you can hear the large bore needle grinding into the bone. So there's that kind of empathetic reaction that makes people a little woozy. There's a biopsy that they do with that bone marrow to see if there's maybe some indication of leukemia, where there'd be so many white blood cells and they wouldn't find any red blood cells in the marrow. There's bone scans, and there's several different kinds of bone scans. There's the CAT or CAT scan, which stands for computed axial tomography, and you guys have all heard of the CAT scans, and that's very often confused with MRI, which actually uses magnets. So it's two different machines that use different technology to produce an image. With CT or CAT scan, it's very high radiation, but it's good to see little bits of the body. It kind of slices up the body wherever the scan is taking place, like a loaf of bread. And so the doctor can look at little sections of whatever it is they're scanning, where MRI uses a magnet and no radiation to create images. And that's really good for soft tissue. That's why people who have a torn ACL or a rotator have to have the MRIs done. And then there's bone densitometry, and we'll talk about osteoporosis, which is a problem more for women than men, and it's diagnosed by bone densitometry or a DEXA scan, and you might get to see one of those too. So here's some disorders of the skeletal system. You have arthritis, where there's inflammation and pain in the joint, and often a lot of stiffness. And you'll see that that's a picture of an arthritic hand, that you'll see elderly people start to get knobs around their knuckles, and their hand starts to get misshapen. It's a sign of the inflammation process and arthritis. There's bursitis, which is an inflammation of the sac around a joint. And these are common in the elbow, you'll see them, but it can be also in the hip. And in the elbow, you'll actually see like a fiery red tissue bulge hanging out. So that's what these pictures depict. But you can also get it in other joints in your body too, wherever there's a sac of fluid or a bursa it can become inflamed or infected. Let's see. Caries is another name for dental cavities. It's a major cause of tooth loss, as you might imagine. Carpal tunnel, which I'm sure you're all familiar with, is when the median nerve of the wrist becomes compressed, or there's pressure on it from usually repetitive motion, like somebody who works on a keyboard all the time, or maybe somebody who plays guitar or something like that, or holds a bow too tight or something. Degenerative joint disease or osteoarthritis is something that people have to deal with as they get older, and it's usually the type of arthritis people suffer from. But there's rheumatoid and there's other forms of arthritis too. I don't recommend any of you get old. Dislocation, which you can imagine, that's when something is out of alignment. It's very painful usually, and if somebody has something out of whack, because we've experienced so much pain when the bones are displaced, you usually will know it. Here's some different kinds of fractures: the green stick, spiral. Green stick's like just a green stick. It doesn't break all the way, just as if you were snapping a green stick out in the woods versus a dried out one. Spiral's a twisting fracture. Convoluted is like a double fracture. So there's some pictures of different types of fracture, but fracture usually comes from trauma. And then there's gout, which is a painful swelling of the joint when there's uric acid buildup. It's very common in the toes, so I included a picture of the toe so you could see what somebody will just be fine one day and the next day they'll be screaming in pain. It's usually an older person and complaining of extreme foot pain, and you look and their foot's all red hot and swollen and angry looking, and you can be sure that there's a gout situation going on where the uric acid is collected in the joint. People can suffer a slipped or a herniated disc. Herniated means like an outpouching of the disc. We're designed beautifully as humans, except two areas that are highly vulnerable: our neck and our lower back. And there's not a lot of protection, and a lot of weight sits on those two areas. Our head basically sits on a pencil, for goodness sakes, and all our organs and our abdomen and our chest sit on a little bit bigger pencil, the lower spine, and all kinds of stress and strain can happen, and herniation of discs is a common problem. And then there's the curvatures of the spine. Kyphosis, which is what I have. I try all the time to sit up straight, but I always have that little old lady hunch it over thing. And then scoliosis, many of you have been tested for that. That's an S-shaped spine, where the spine, instead of going north and south, straight up and down, it goes east and west. And then lordosis is a sway back, and a lot of like pregnant women you'd see with their back arched, with that hyper arching of the lower back is called sway back. Is called lordosis. Meningomyelocele, I included a picture of that. It's where the spine develops outside the spinal, or where the spinal nerves and things leave the spinal canal and start to develop outside of it, and there's a picture of that. Something that's very good to know before a baby's born, before they're forced out the birth canal. Osteoma is a bone tumor. Again, oma, a suffix that means tumor. Osteomalacia, or rickets, is caused from a lack of vitamin D and calcium, and it causes that kind of a bone deformity in the picture. Osteomyelitis is when you get a bacteria infection of the bone, very serious, end up in the hospital on antibiotics, because if it gets into the bone, then it's in the bloodstream and can cause death quickly. Osteoporosis is a weakening of the bone from lack of calcium. And then there's another form of arthritis, rheumatoid arthritis, which is a stiffening of the joint and thickening of the synovial membrane where the fluid is in the joint, so it doesn't move as freely, and that's not fun. So in 14 minutes, that's the skeletal system and what you need to know. And I hope you took notes, but if not, it will be posted here on the blog, if that's where I got it, if that's where I put the link. So have a good day.